Hi, folks. My name is Greg Turner, the radiology coach. My job is to demystify the enigmatic world of x-rays.
Patient engagement is a popular trend in many healthcare environments today. It involves medical practitioners having access to patient behaviors outside of clinics and establishments. When doctors can see what their patients are or are not doing on a regular basis, they can then recommend proper treatment. But they can also document that the patient may or may not be following instructions. Patient outcomes reflect back on the physicians, and yet it is important to understand that there must be a certain amount of information that is shared when expectations are placed on a hospital or clinic. The collaborative nature of healthcare requires that patients or their families or surrogates participate in their care. The effectiveness of care and patient satisfaction with the course of treatment depend in part on the patient fulfilling certain responsibilities. Here are a few things that are required from patients in order for them to reach objectives and experience positive outcomes. Patients are responsible for providing information about past illnesses, hospitalizations, medications, and other matters related to health status. Patients must take responsibility for requesting additional information or clarification about their health status or treatment when they do not fully understand the current information or instructions. Patients are responsible for making sure that the healthcare institution has a copy of their written advance directive if they have one. Patients are responsible for informing their physician and other caregivers if they anticipate problems in following prescribed treatment. Patients also should be aware that the hospital has to be reasonably efficient and equitable in providing care to other patients and the community. The hospital's rules and regulations are designed to help the hospital meet this obligation. Patients and their family are responsible for being considerate of and making reasonable accommodations to the needs of the hospital or other patients, medical staff, and hospital employees. Patients are responsible for providing necessary information for insurance claims and for working with the hospital as needed to make payment arrangements. A patient's health depends on much more than healthcare services. Patients are responsible for recognizing the impact of their lifestyle on their personal health. Our healthcare system now has a culture of care and an obligation to respect and abide by these statutes when executing treatment. These bylaws were designed to prevent patient neglect or abuse and to encourage healthy professional applications of care. Patient privacy has also taken priority and is of paramount importance to most facilities and clinics. But let it be known that the exchange of information, patient compliance with agreed treatments, and fluid communication are critical in doctors realizing success in their patients. That concludes this episode of What are Patients' Responsibilities with Their Care?
If you like this presentation, please select the subscribe button below this video. You can also tap the bell next to it so that we'll notify you when other great videos have posted. My name is Greg Turner, and I'm the radiology coach. And remember, mark my word and mark your films.